Hi, I'm Betsy West with the Falmouth Chamber of Commerce, and today I am here with Karen Gardner. She is the CEO of the Community Health Center of Cape Cod. Welcome.
Thank you. Thank you, Betsy. So nice to be with you today.
Thank you. Tell me a little bit about the services and programs that the Community Health Center has to offer.
Sure. Thank you. So we are Community Health Center of Cape Cod, and we are what I would call a large primary care community-based practice. And we offer services to about 21,000 registered patients as of this moment in time. And about 1 in 5 Falmouth residents actually seek care with us at this point in time. And we hear from Falmouth residents and all of our constituents that our programs and services are very robust, accessible, approachable, integrated, and that's what keeps individuals coming to our practice and staying with our practice, along with the high quality medical providers. So our main office is in Mashpee at 107 Commercial Street. We also have locations in Falmouth, right in the corner of Gifford and Jones Road. And then we have locations in Bourne, Centerville, and then we're opening later this month in Sandwich. So really any Falmouth resident, any resident can come to any one of our practices at any time. We do offer also walk-in services at our Mashpee and our Centerville locations. So in between, sort of on the urgent care notion, you don't need an appointment, you can always come in. But the general program that we provide is primary care, but as a health center, we really consider primary care very broadly. So yes, we have family practitioners and internists and those general practice providers that you would go to on a regular basis. But healthcare for us is much more than that. It's that integration. So we have behavioral health providers, both licensed counselors and psychiatrists, dental service providers, a dental surgeon, hygienists. We actually in Mashpee have a very large dental clinic with 10 chairs and have dental services also available in Falmouth and our Bourne location as well. We have access to pharmacy services. We operate our own pharmacy. I don't know that everybody always knows about that. Not at every location, because you can imagine there's a little bit more involved with pharmacy.
Right.
But here in Mashpee, in our Bourne locations where we have a little bit more space, we're able to offer pharmacy. And pharmacy services are a little special because it's what's called a 340B pharmacy. So we're able to provide access to medications for individuals who may have insurance gaps. So
Oh,
things that could be done on a sliding scale, as is the case across all of our programs and services. We're
right.
really here for everyone, whether they have insurance or don't have insurance or are caught in between because of our service economy. We see that a lot on Cape Cod. People are working, and during the winter months, they may not be as working and they fall in and out of coverage. So access to all of those services is important on a consistent basis. We also have optometry. I got my eyeglasses at our optometry clinic. Wonderful providers, optometrists, and an eyeglass center here in Mashpee as well. Women's health services, the list is endless, it seems. I'm
Right.
so proud of everything that we do, but gynecology on staff as well, so that you don't have to go too far for specialty care outside of our health center walls. And then later this month, we will have a endocrinologist joining our staff. So
Wow.
we know that some of those chronic diseases, diabetes being one of them, it's tough sometimes to get into endocrinology. Dermatology, the same thing. We do have a very small derm practice. So all of these services we define under one roof as our primary care integrated model.
Mhm.
And again, we're here for everyone in the community.
Wow. I had no idea. Some of those services I knew about, but many I didn't. And so it's really a full service. and the fact that you're able to fill in those gaps
Yes.
for people with the insurance and non-insurance. Um, COVID safety is a concern. I know you just got off a call from that, and we tend to during this time out of fear delay having tests, going to the doctor, addressing some health concerns. Can you
Mhm.
tell me what steps you take to one have a safe environment for the patients, and then to ease those concerns for going to the doctor during these times?
Absolutely, absolutely. So this COVID journey has been crazy. I can't believe that it's been 9+ months at this point. And totally that fear and anxiety in the beginning, not knowing what to expect. We certainly can understand that we needed to stay home and we needed to isolate and wear masks and all of that. But yes, to your point, people had delayed their care for preventive health, whether it be mammograms or even blood glucose checking, the A1Cs, or even blood pressures, but definitely prevent or delayed some access to some of those things. Over time, we've gotten very experienced as a healthcare community and as a community in general. I think we're very good now with PPE. In the beginning, there was that PPE scare as well. PPE is fully stocked at the health center. We also very much utilize social distancing. So any social distancing requirements that are in the community, you will also find at the health center. We also have taken significant steps to welcome individuals back. Not to the extent. So where we may have seen 300 patients a day at one of our locations previously, we've reduced those schedules about in half at this point. In the other half, we've employed telehealth technologies. So coming to the provider's office, and I've heard a lot of positive comments, quite frankly, from patients saying, I came for my annual physical and it really was okay. I was the only person in the waiting room, or if there was a person in the waiting room that was several, across the room, I felt so safe. So that was good to hear. That reinforcement is important, and certainly the staff cares about our patients' safety and the safety of ourselves as well. We've been a part of keeping the community healthy. We are offering testing as well, both
Oh, great.
symptomatic and asymptomatic testing.
Mhm.
That's part of our workflow. We also offer rapid tests in addition to the PCR tests.
Good.
And we're getting into the vaccine distribution. So we've been actively distributing vaccines, and we'll start next week along with the rest of the community and
Uh-huh.
in our over 75 more complex population as well. But it
That's good news.
Yes, yes. Um, so we have a little ways to go, but we do encourage individuals to keep their preventive health visit appointments, their testing. We want to make sure that healthy Cape Cod is a reality, and we
Right.
don't lose too much ground because of this crazy COVID-19.
Right. Wonderful. Wow. You guys are doing some great work. You shared what your locations are, but how does someone reach out, someone, whether they're new to the community or, well, there are a lot of people who are staying year round and people with families and children. So, how do they connect with you to establish a relationship?
Yes, there are a number of ways that someone could reach out. Our website. So
Mhm.
our website is a little bit interactive. If you're interested in becoming a new patient for any service, you can download an application directly off the website and fax or email us securely in. So our website will have that instruction. You are also welcome to call our main number in 508-477-7090, and you can be immediately connected to someone who can help navigate and maybe ask questions. Many people have questions about what programs and services and may need something a little bit more urgently. Um, Access is very, very important to us. We try to make sure that a new patient that is seeking services are registered with us within 5 days. But then, as you can imagine, it may take a little time to get that first appointment. But if there's a need to be seen urgently, we can always make that happen. And I want to make sure that the community does know that. Also welcome to come into the main location here in Mashpee and pick up an application. But honestly, discouraging that a little bit right now. Of course, you're welcome to do that, but where a phone call may do it or checking the website, something like that might be a little bit safer during these times, or a little bit more convenient during these times, I should say.
And those of us who are on social media, I also went to your Facebook page and Twitter
Yes,
and saw some live interviews and COVID update information. So I know you're out there. And I just want to say thank you for your time today and welcome you as a chamber member
thank you.
and let us know how we can help to amplify what you do in the community. Thank you very much. Thank you for your time.
Thank you. It was wonderful. Bye-bye.